Okay, so the numbers, there are really two key numbers. So the first key number is 308. So if they've got an osmolarity reading above 308, they're hyperosmolar, and if it's 308 or less, they're not. The other very important measurement is the difference between the eyes. So if they have a difference of 8, and to just give you an example of this, if we were just to measure one eye and say it came in at 296, we go, that's normal. But perhaps if we had measured the other eye and that had come back as 312, we now realize that the patient is hyperosmolar in one eye, that they've had a breakdown of the autoregulation of their ocular surface, and that this probably is a dry eye situation and we can start treating it. So another example might be if the readings were both below 308, but the difference was more than 8. So although taken in isolation, this is normal osmolarity. The fact that there's the difference suggests that there's been a breakdown in the autoregulation, and perhaps for this patient, they should have had an osmolarity of 260, and it's gone up for them. And it's sort of analogous to our glaucoma patients. We may have a patient with technically normal intraocular pressures, but everything else is telling us that they've actually got glaucoma. We would go with that. And also, similar to the glaucoma analogy, we take many different tests, we incorporate them to make our diagnosis of glaucoma. In dry eye, we take many different tests and we incorporate them to make our diagnosis of dry eye. And as we become more experienced, so we weight our tests differently. And the thing that I've learned is that the hyperosmolarity really does go well with the response to treatment. So I'm finding that I'm believing that more and more and more, because some of those other tests, tear breakup time in particular, don't have great sensitivity and specificity. So they're not reliable. They're traditional, they're the things that we were all taught, and we probably give them more weight than they deserve. And I think that as time goes on and people become more familiar with the numbers, so they will pay more and more attention to hyperosmolarity.